Okay, right. Okay, so our first speaker today is Jane Dayus-Hinch. And Jane was born in the Black Country, which is a part of the UK in the West Midlands. She left home at 17 and moved to Lichfield at the age of 21. She's enjoyed a very well-travelled life full of many adventures and can tell lots of stories. Jane met John in 1977 when he was the drummer in the band Judas Priest, and they went on to be married in Lichfield Cathedral in 1987, and Lord Patrick Lichfield was their photographer. They had a son, Fraser, in 1993, but sadly divorced in 2009, and they remained good friends until John died suddenly, drumming on set in 2021. Oh, that's sad, Jane. Jane has always lived life at 200 miles per hour, but she always rides her Harley-Davidson Softail at a cruising speed. Yes, Jane is a rock chick and a biker, but you would never know that she has been a professional wedding planner for over 35 years. She hosted her own TV show, Wedding SOS, filming for 6 years in Toronto and New York. Jane is a fairy godmother who grants 3 wishes to make sure that the couples have the wedding of their dreams. She is well known for her collection of fabulous hats and matching outfits. She describes herself as a bit of a rebel. Jane married Robert on Christmas Day 2019 in a surprise wedding in Wales, as none of their 10 guests knew that they were to be wed on the day. Robert sadly left Jane after she received her cancer diagnosis. Jane is a committed Christian, a volunteer for many organisations. She has a huge heart and a large circle of close, long-standing friends who love and support her. At 64, there's still no stopping Jane, as she was one of the Queen's baton bearers at the Commonwealth Games earlier this year and is writing her book, It's All Smoke and Mirrors. As she says, you only show the world what you want them to see, not actually what's going on behind the scenes. And I give you Jane.
Yay! How fabulous is that? What a great introduction. There's my life in a nutshell. My story. And the reason I've given it the title, It's All Smoke and Mirrors, is because when I had to sit down and analyse everything, my best friend who was with me at the time, she said, your life has always been, you do this wonderful front, and absolutely nobody knows what's going on behind the scenes, just like your brides. Even if their venue is burning down behind you, you're going, it's going to be fine, I'm going to sort it out for you. And that's me. Look after everyone, make sure everybody's happy. And me, well, I'll sort myself out afterwards. When I got my diagnosis, I'd been unwell off and on for about 5 years. I'd had endoscopy, colonoscopy, MRI, CT, you name it. Over 5 years, I am not a person to go to the doctors, but I knew something wasn't right. And all I was told was, I've got IBS, take the Buscopan, take the Buscopan. They sort of pacified me by saying, well, we'll have a look, you know, we'll do some tests and whatever, but there was never anything conclusive, and they made me feel as though I was wasting their time. Eventually, when it came to lockdown, I was very unwell. It was in the early weeks, and we'd moved house, Robert and I, because it was 2 houses into one. And we moved to a different area, and it was a new GP. And I asked if, you know, someone would see me and speak to me, and Dr. Stokes was the best GP I think I've ever met. And he said, what do you think it is? And I said, I have no idea, but this is what I've been enduring. And he said, well, we'll send you for an ultrasound. With the ultrasound, it came back within 2 days to say that you have tumours in your liver. And this doctor, this random doctor who I'd never met or anything, just said, you've got cancer. And I said, how do you know that? When you've taken no blood tests, I've had no investigation, I've had no biopsy. How do you know? She said, I can see it in your liver. And that's not going to be your main tumour. We will have to find the main tumour. I called it one of my baseball bat moments in my life, where somebody hits you with a baseball bat and you're left standing reeling. It was the most unusual day. The day was the energy was really odd. And as we came back, because I was told to bring Robert with me, my ex-husband, who we've got on really well with, was sitting on the drive. He never did it before, never did it since, but he got a feeling. He said he came on a feeling, and he was sitting on the drive, and he said, "Is everything okay with you? Because I just had to drive over here today." And I said, "I've just been told I've got cancer. Why have you driven over here?" And after 30 odd years, I suppose you've got a bond. But he wept, he sobbed, and he said, "Not you. You're the one that is vegetarian. You don't smoke, you don't drink, you go swimming, you take care of yourself. I'm the one who chain smokes, is an alcoholic, never exercises, eats rubbish food. Why isn't it me? Why isn't it me? Why is it you?" And we had all of that. I said, "I don't know why it's me, but why not me? Why not me?" Because now you hear, used to be you never heard of anybody having the big C. Now it's every other person you hear that has cancer. I was sent to Stoke, which is an hour away from here. And I was basically told it's incurable. The gentleman had got tinted glasses on and a mask. I couldn't pick him out in a lineup. And he basically said, "You've got stage 4, grade 3. We will give you something that will help you to stay comfortable. But basically, reading between the lines, go home and die. But we'll give you the morphine on the way." And as we came out of the room, which was the same room that Robert's wife, Glenn, had been diagnosed 10 years before, and Robert was sitting in the same seat. So to be newly married and to have had the same diagnosis, Glenn had pancreatic cancer. And I believe that was 8 months, start to finish, and not a good experience. I said to Robert, "You don't have to do this. I know we've just got married, but you can walk away. You haven't signed up for this twice." But he said that he would stay. From there, I decided to get a second opinion. And through a friend of mine who's on the board of the QE, I asked if I could see someone, and she arranged it for me. Because of COVID and because of there was just nothing where you could get in touch with people. And I was assigned to Dr. Shah. And Dr. Shah must have been having a good day that day, because he was having a coffee and he rang me up and he said, "I'm actually going to downgrade you, because at grade 3, stage 4, you cannot receive any treatment, but if I downgrade you to a 2, you will be able to have some treatment." And I made him laugh. I said, "Well, all my life, Dr. Shah, I've gone for the upgrade on everything, but today I'll take the downgrade. Thank you," very graciously. And I started to have monthly injections to offset the side effects. And there was no appointments going in. It was all done on the phone. And I felt as though I was declining quite rapidly. My weight was dropping. I felt more and more ill. And it was then decided that I would be put on chemotherapy, Cap-10, capecitabine, which I was to take by pills at home. After the first week, I was desperately ill. And I was taken into Stoke Hospital and they said, this isn't good. This is a violent reaction to it. Stay off it for 2 weeks and we'll try again in a couple of weeks. Tried again. And on the second time again, I had a blockage. I was desperately ill. Enemas, you name it. They tried everything and they said, you have a blockage and we have to get rid of this. I didn't understand what the blockage meant or whatever. It wasn't really explained to me. But on the third attempt, I managed to do almost the 4 weeks. And the one day, the district nurse was sitting here and she was saying to me, Jane, please, please don't vomit. Don't be sick. And there was a bucket next to me. She put an injection into me. She gave me a pill under my tongue. She was saying, just wait for the oncologist to phone. Let's find out what we need to do, Jane, but please don't be sick. And just as the phone rang, it was like a trigger point. I rushed to my downstairs washroom and I couldn't believe it. And I mean, we do have to be graphic with this disease or condition. I was vomiting up poo. I don't know whether you could imagine what that's like, but let me just tell you, that's when you know you're done for. That's when you know there's no coming back from this. The oncologist, I heard her shout on the speaker, get her in an ambulance now. I got in that ambulance and I looked around my house and I said goodbye. When I first received my diagnosis, I organised my funeral. I lodged it with Canon Andrew. I chose my coffin. I chose the flowers. I did everything because my 29-year-old son would no way cope with trying to organise a mother's funeral. So all of that was done as I was diagnosed, and my wishes. So I knew that that was all in order and my will was in order. It took an hour to get to Stoke, and John, ex-husband John, was drumming on a advert on a TV set down in London, and he phoned me. And on the Sunday, this was on the Tuesday night, on the Sunday we were all sitting having Sunday lunch together, and if anybody takes anything away from my story, take this. We were all sitting there together, Fraser and his fiancée, my mother was sitting there, John was there, Robert, his son. My thing is to have the family around the table. And on Sundays, we all sat there, said what we were doing during the week, what was coming up, even through COVID. It was our pact. We got through it together. And we were laughing with John because he didn't want to go to London. He thought he was going to catch COVID if he went to London. And I said, listen, what I'm going to do is I'm going to give you my spare phone, my iPhone. So you haven't got to take a camera. Bearing in mind, you know, he was 73. And you can take photos, you can phone me, you can do everything. So I'm in the ambulance. I don't take his call. Because if he'd have heard the sirens, the blues and twos going, no matter what, he would have said, sorry, I've got to go back. He always said, my wife's ill or whatever. And so he left me a long voicemail because I didn't answer. And I got into the hospital, and you always know, if there's one or two there, it's okay. If there's 5 of them, well, it's a bit serious. If there's 8 of them, you're done for when you go through those doors, because to get that amount of attention. So I've now got cannulas in both arms. They're trying to get this tube up my nose. They are shoving injections in me. And you're thinking, well, take it all, take it all. If they can save you, this is good. And the phone went, and it's flashing. And the nurse said, do you want me to get the phone? And I said, yeah, put on speaker. She said, it's Robert. I said, that's fine. That's my husband, because he couldn't come in the ambulance because of COVID. And I go, hello, I'm still here. And there's silence at the end of the phone. And I'm like, have you got it on speaker? I said, yeah. And they're still trying to get this tube up my nose. I'm going, just wait a minute. I said, hello. And all I can hear is crying, is sobbing. And I'm like, are you all right? I'm all right. I'm okay. Smoke and mirrors. I'm okay. If you could only see what's going on here. And he said, John's died. Pardon? John's died. No, he hasn't. He's just phoned me in the ambulance and I didn't take the call. He said, yes. And then he walked outside and dropped dead. All the machines went off. They didn't know whether I was having a stroke, a heart attack, but they knew. And they were saying, who's died? Who's died? And I'm going, my husband's died. And they go, I thought that was your husband talking. It sounds as though I've got 6 husbands. No, I've just got the 2. And I was left lying there, and I have a very strong faith. So I asked everybody to leave the room, which they didn't want to do. And I had a word with God, a direct word with God. And I said, right, you've had John, you've got John, but you're not having me. You're not having me tonight, because my son, within the space of 3 hours, can't lose his dad and his mum. He cannot lose us both in one night. We were all sitting having Sunday lunch together Sunday, and 2 days later, you can't be losing your mum and your dad in the same night. With that, I had the worst night of my life, where nursing staff didn't nurse. Doctors were nowhere to be found. And I've never felt so alone in my life. From there, they decided that the next morning, I was on the phone to I was trying to find John's body, because an ambulance had taken him and gone to the mortuary and we couldn't find him. And on the day after that, I was on to the coroner, and this gentleman, very kind gentleman, kept asking me, shouldn't I be resting, and how could he help? And that was Mr. Farmer. He's a surgeon, and he looked at my name, remembered my name, and on the Monday, after I'd been released, he said, I'm going to perform surgery on you, and I'm going to get rid of this blockage, and we're going to help you and do this. And I said, no, you're not. No way. I've got a funeral to organise. And it came down to, if you eat anything, Jane, you will die, because it will get stuck, you'll get sepsis, and you'll be gone. So for the 3 weeks it took to organise the funeral, I had a teaspoon of baby food out of a baby jar on the hour every hour. But I lost £1 pound a day. Let's just say, if ever you want to go on a diet that has dramatic results, I recommend baby food. I attended my ex-husband's funeral after organising it all at Lichfield Cathedral, where every other funeral was 30 people. We could have 170. And even though it was live streamed, even though I tried to make everybody happy that wanted to be there, I was so desperately ill, I don't know how I was standing up. But 2 days later, I was in and surgery was performed. It went well, in that as they were taking out the blockage, which was the size of an apple, they found the neuroendocrine tumour in my small intestine. Apparently, they had a whole meeting in the theatre to ask whether they, whilst they were pulling on the intestine to put it together, when they found it, whether they could take it out, which I found quite odd. Why wouldn't you take it out? needless to say, when I came to and Mr. Farmer came to see me, I asked to see it, which he found was a very strange request. I said, I want to know what it looks like. I want to visualize it. It's a bit of me. Why have you got it? Did I sign to say that you could keep it? I want to keep it. I want it in a jar. He thought I was most odd. And he explained to me that it was like a white pickled walnut, and it had got lots of things coming off it, and it had already gone, you know, to be analysed. And basically, how dare I ask to keep my own neuroendocrine tumour, you know? So he appreciated my sense of humour, and I did his, and we got on very well, and I helped plan his wedding. So, you know, best wedding planner, best surgeon, you know, you can still trade your services. And from there, mentally, I felt better that it was gone. But they explained to me that it was never about the tumour. It was always about the 85% tumour burden in my liver. And that was the problem. I let the dust settle after all the surgery, John's death, and trying to become myself again. People were telling me I looked fabulous because I'd lost weight. One time in my life, I didn't feel fabulous, and everybody was telling me I looked fabulous, which I felt like saying, do you want to see my insides? You know, it might look pretty good here, but do you want to, shall I carry a picture about of my insides, you know? And my friends were very worried about me. I don't have much family at all, very small family. So I rely very heavily on my friends, which I've had for nearly 40 years. And life then, I went to the oncologist. I've got the best oncologist, Dr. Caroline Connolly at Stafford. And I decided that after all the reading and research and everything that I'd done, that I would like to apply for a clinical trial. One of the things that has kept me going is the NetNatter support groups. I was the one person who would never go, and I love to talk. I would not go on the NetNatter groups. Why? Because I actually said this. I realise how stupid it is now, but I believe when you go in the toilet and you close the door, it's your little world. You don't talk about what goes on behind the closed door, do you? And I felt as though if I went in the NetNatter groups, it would be like AA groups sitting around talking about poo. And there was no way I was going to sit and talk about poo. It's like, I can't do that. And the one time that Dr. Shah was deployed to the COVID wards, I had a Dr. Shetty come on, and he said, I don't understand why you're not on the NetNatter groups, and you'll be, you know, talking about, you could. I said, I can't do that. And he said, just try it. There's one tomorrow, just try it. So on the Saturday morning, I put my picture up. There was no way I was going on, you know, no, can't do that. And it was just two ladies chatting. And I found out, they said, oh, it's Saturday, can't wait to have a glass of wine. And I'm like, you drink? You drink? Well, I don't drink, but I'm surprised with liver complaint. You drink? Very good. And then they started to talk about when they ate food, they had, the one lady took 3 crayons and the other one took 9 crayons. And I'm sitting there going, crayons? Why would they eat crayons? What colour crayons do they eat? What make is it? Does it come out in the poo? How bizarre. So I carry on listening to this, and they didn't know whether to up the crayons. And the facilitator, Nikki, is talking them through this, and she's not asking me, I'm just listening. Now, behind the scenes, my son and his best friend talk about people in crayon language. So if you're a red crayon, you're very angry and whatever. If you're black crayon, you're very dark. And if you're a white crayon, you're a complete waste of time. So I was thinking, is this the same terminology? You know, we talk, I have no clue. So I came in and I had to ask, and I said, excuse me for asking, ladies, you know, newly diagnosed, and I've come on this natter group, and I'm just fascinated. Is there a particular brand of crayon that you take with your food? And they're like, brand? And that's, yeah, where'd you get them from? And Nikki sort of went, what is it that you're asking, Jane? I said, well, is it a specific colour or what? And she said, what are you thinking? And I said, they eat crayons with their food. And she said, no, darling, you've heard it wrong. It's crayons. And I'm like, crayons, what are those? And she goes on to explain pig's enzymes and whatever. And I was so embarrassed. I was mortified that I genuinely thought that people went out and ate wax crayons with their food to show up in their poo. So from that, I decided that I would join the natter groups and the neuroendocrine cancer groups with Nikki and Katie and Leanne. I just have formed such friendships, and I've learned so much about my condition that I go on every one now to share all my knowledge of what helps me on a day-to-day basis. I, yes, carried the Queen's baton, but I did a fundraising thing with it to raise awareness for neuroendocrine cancer. And I've just had my 4th PRRT treatment. I was accepted on the clinical trial. I had to go to London, had to go to the Royal Free, which I cannot fault in any way. And I have my final scans on the 5th of December. And from there, we will know within the 12 months where I started and where I am now. The difference, there is no comparison to me. This time last year, I was in a wheelchair. I was breathless. I couldn't get about. I was a stone lighter than I am now. I was skeletal. I didn't want to eat. I didn't like any food. I got a metallic taste. My hair was coming out in handfuls. And this particular day, I looked back in my diary last year, and my end-of-life nurse was sitting with me. And she actually asked me the question, how does it feel, Jane, to be facing your last Christmas here? What would you like to do over Christmas, because it'll be your last Christmas? And I was left, as she drove off, going, what do you want to do on your last Christmas, Jane? And I put, I want to see another Christmas. I want to think about it as my last. And that was today, last year. And then 3 days later, my mother died. And to have 2 empty seats at my table on a Sunday, to have lost John and my mum at Christmas, and then when Robert left, he couldn't watch me, as he said, slowly die through neuroendocrine cancer. Plus having the actual condition, not disease. That's why when people say to me, how are you doing, Jane? it's smoke and mirrors. You just tell them that you're fine, that it's good, you're still here. They find that quite amusing when the palliative care nurses ring and I go, still here, still here. And yes, I will be here for this Christmas. So that's my story. I'm looking at the clock and going, I can't believe I've done that.
Thank you, Jane. Yes, no, that was absolutely wonderful for you to come and to share your story with us. We are honored and thankful to have you here and for you to open up to all of us, and we can get your perspective of, you know, what you've gone through and what you continue to go through. And we are so proud of you.
Bless you. Thank you.
Thank you
Does
so much.
anybody have any questions? This is the bit I'm looking forward to. Oh, go on.
Does anyone any questions for Jane?
You're just giving us more encouragement. I'm actually from Poland, from Europe. So I left 20 years ago, my country. But you are giving us even more encouragement. With neuroendocrine tumors, it's so difficult to get funding from NIH and CI, but we are still fighting with those organizations, and we are still writing grants and asking for support. So with your story, you really gave me more power to write another grant, to do more experiments, and to really do the neuroendocrine science. Thank you.
Well, I was asked by the Royal Free and I received a phone call and I actually thought it was a scam. And with my sense of humour, I went along with it to find out that it was a genuine researcher from the country Greece. And they were asking me, they sent me a whole document, which took many hours to complete. I then had a big Zoom call with oncologists, radiologists, consultants, everybody was on there and they asked me so many questions. This was then followed up with another lot of paperwork, which I completed, and it was to help them get the funding for neuroendocrine cancer in Greece. And right at the end, they said, can we ask, this has taken so much of your time and whatever, why would you do this? And I said, well, one woman in Australia must have gone through this so that I in England can have PRRT. I'm so desperately grateful for having the PRRT, and I've had 4 sessions. I'd had 3 at that time. And she went on to say that that was good, but I wanted to complete all the research and everything so that one woman in Greece can have what I've had. And she actually put that on there, that people do it and they pay it forward, which is an expression we use, you know, you're so grateful, you want to help other people. And I believe they've done really well in Greece in trying to gain their funding.
Absolutely. Well,
so if I can help Renata, I will.
Wonderful.
Thank you. I really wish, you know, NIH and especially NCI people, scientists, could hear stories like this. Because in the comments, we quite often hear that this is rare disease. And sometimes I feel maybe I should change just to support myself, support my salary, support my job. But we are still hanging in this. And I think with Jason, Rachel, and our group, we are moving forward and we are finding new things, even trying to figure out how to help people who have low SSTR2 expression, which is high expression is actually mandatory to get PRRT. So we are trying to look how to help people with the patients with a lower SSTR2 and have some ideas to do this.
Well, anything I can do to help, you'll always find me very willing at the end of the phone.
Thank you,
so much.
Jane.
Thank you.
All right, so we're going to move on to our next speaker, which I'm going to have the honor to introduce. This is John. Metzcar is our next speaker. John received his BS in chemical engineering from Purdue, his master's in medical physics from Indiana University, And he is also currently a PhD student at Indiana University in biological and intelligent systems engineering, complex networks, and systems. But beyond all those fancy words, John also is an MEN1 patient with neuroendocrine cancer and president of Amend USA. And we are very fortunate to have John also here today to tell his story as a neuroendocrine patient and researcher. So without further ado, John, the stage is yours.
All right, thank you. Thanks for that great introduction. Jane, it was so just great to hear your story, and thank you for sharing. Maybe if there's time, I have a question for you. You can think about it for a second. What do you, and then maybe we can talk about it, or I'll email you or something. What do you say? How do you answer the question? Because I always say I'm just fine, and it's sometimes it's true, and sometimes it's not. So that's an interesting. I look forward to seeing your book too, and addressing that.
Well, it's when people ask and they say you look so fabulous. I even had a comment that I was actually radiant. I was radiant. The comment was, and I turned to my friend and I said, well, that will be the nuclear glowing. Because I didn't know how else to say. Sometimes I feel like having a badge, going, still here facing forward.
Mm-hmm.
Because sometimes you just, if you are feeling under the weather, and I've just had 3 days of really being under the weather, and then people tell you that you look great, you're going, that's the smoke and mirrors, because you've got up, showed up, and you're here. But afterwards, you'll be lying flat somewhere.
Huh. I'll keep thinking. I mean, that's really interesting. I'll keep thinking about that. Again, maybe there's opportunity for us to have some correspondence or something. I just so.
Well,
What's that?
The floor is yours.
Okay, thank you. Well, I have a different story as expected. And I brought props because that's what I do often. So, and in this case, by props, what I actually mean is slides. Let's see, I lost all of you. My keyboard shortcut didn't work. There we go. And we'll just try this and see how it feels to us all as a group.
Looks great, John.
And go from there. Great, thank you. Okay, so I ended up brainstorming with Selena's help. We brainstormed the title Coming Together, Advocacy, Community, and Family. And so I'll just try to, tell my story, which is, it's an interesting challenge. So, and I have some disclosures that I, like others in the audience, passionately believe that it's only by coming together and sharing that we will make progress in both our individual trajectories and as a community, and that we are the change that we wish to see. So hope that's okay. So my patient experience, as Rachel said, kind of it starts with multiple endocrine neoplasia. There's more than one kind. I have type 1, and it's a family affair because it's a genetic disease. So more than one person in my family has it, and it involves a lot of monitoring and imaging and surgeries. It doesn't always involve surgeries. It often does. Pretty much always involves monitoring, lots of appointments, waiting rooms. And it's, when I was diagnosed, it was exactly a baseball bat moment. We kind of known about it for a while in my family. My sister identified it, so the credit goes to her for really doing the diagnostic journey for us. And then once she was identified, it was easy for other family members to be identified. And so I was in a car on my way to a dentist appointment when my endocrinologist called and was like, hey, so that scan revealed several tumors. You're going to need to have surgery. But I'll get to that. So then in terms of community, this is kind of how the talk goes. I've got multiple endocrine neoplasia, then family and community with work and friends and learning and people that I've worked with and Amend USA and other organizations. And then I think that really goes into advocacy, which is knowing your options, creating change, and teaching and learning from others. So MEN1 is a genetic disorder. It affects 3 glands in particular: pituitary, parathyroid, and pancreas. I have effects on all 3. Not everybody does. I was diagnosed in 2019. And then bam, I got a CT like December 31st on 2009. And then I had surgery like 5 weeks later for a lung bronchial net. And it was tough on all of us. And it was a true family affair. My parent was also, one of my parents was also diagnosed. And then, but life went on. I had other family that continued monitoring and surgeries. A few years later, I had my big surgery. So in 2013 or so, late in the year, imaging revealed alarming prognostic features in the primary pancreatic neuroendocrine primary. And so I had to go. I got surgery scheduled, and then it was scheduled so that I would have time to recover before I became a father. I even, in my recovery, I put weights in the baby carrier so I could feel what it would be like to have a baby in there. And well, the slides are a little bit messed up, I guess. But so then I had a distal pancreatectomy. So this is the part that got cut out. And then also I did genetic testing. I think that no talk about a genetic disorder can, it should be mentioned. That's really important. I had genetic testing, and that fertility and family planning are often a part of the experience. And that I think is true of anyone who's undergoing cancer therapy that is kind of like an adolescent or young adult, is that fertility can be an issue. And then in the case of a genetic disorder, then you know, no matter what, you're making some kind of decision. However you make that decision for you and your family. So after all this, so again, post-surgery, things continued. I began to aim to join the research and clinical community after experiencing all of this. I'd made a promise, committed to my endocrinologist to make a difference. And also I think I may have messed up these slides again. We'll see what happens next. Basically, I was high. I was high after my lung surgery. And my endocrinologist came in, and I was like, oh, I'm so happy to see you. It's so good you're here. And then I'm gonna make a difference. And I don't know, I remembered that and stuck with it. And so with aid from my employer and family, I started a master's degree in medical physics. And that's where I got my taste for cancer biology and targeted therapies. And while monitoring and therapies continued for myself and my family. And I think a note here that I think is important is that, a lot of what I was doing here was I was both curious and also just afraid. I did not understand what was happening. And I really, just like you said, Jane, you're just like, at one point you said that someone didn't explain something, you didn't really understand what was going on at the time. I'm sure you learned, but that's what it was like, appointment after appointment. I just didn't get it. And I wasn't comfortable with that, and was naturally curious as well. So that's another reason why I started down this educational journey. So that was 2014. Started my master's degree, had a kid, and I started in 15 for my master's degree. And then eventually I applied to and joined a PhD program in cancer modeling. So that's the kind of like the logo for our group. Meanwhile, NetSpot came out. And I was very nervous because at that point I had enough knowledge to know that it was not unlikely for me to have some kind of recurrence or a new primary. The surprise was that it was in my liver. I think at the time I didn't realize just how at risk of recurrence I was. So there it was, and I got put in medical oncology. First, watchful waiting. I couldn't find a binocular icon, then a somatostatin analog. These are huge. I got to play with one at a recent meeting. Serious business right there. And then I got put on Afinitor, which is a targeted therapy that is intended to slow the growth of neuroendocrine tumors. I was on that for a long time. But these interventions didn't occur in a vacuum. It was very, very challenging for me to deal with the recurrence in 2017. So I wanted to highlight here that I guess I wanted to highlight that it's not, we're not doing this alone, and that it takes a lot of people and a lot of different processes to have a whole healthy, happy life. And that, of course, the cancer is one thing, and we can read a case report, but there's a lot more to it. So I'm very grateful that the cancer center that I am seen at has embedded within it behavioral health services, and as well as the attending oncologist believes in them, and so they connected me with a therapist, and this was really helpful. Acceptance and commitment therapy, mindfulness-based stress reduction, and then also I was connected with psychiatry. My sleep was terrible. I was almost afraid to go to sleep. It just was really dark in there. I don't know how to describe it. I'm sure some folks may have been in that situation. So, but in the middle of it all, including the shots in my butt and the calls to insurance and PhDing, I see this call out for Amend USA. Amend USA is an acronym. It stands for the Association of Multiple Endocrine Neoplasia Disorders, USA. It actually started in the UK. I'm completely failing on where the person who runs it is located. I think it's east of London, although London's pretty far east. So I joined Amend USA as a board member to give me an outlet and an opportunity to get back. I really wanted to make sense of what was going on with this recurrence. When I found community and mentorship, it was the first time I'd talked to someone with MEN1 outside of my family. So Joe Gray, Jason Keller, and then eventually people like Elise Skellerman and Mary Zoller are all I've eventually got connected with, and many, many others. So from there, I attended a NANETS annual meeting, and NANETS is another acronym. They're the North American Neuroendocrine Tumor Society group. It's medical education, but it's a lot more than that. So I attended their meeting. I attended the World MEN meeting. It's not the World Men meeting. It's very difficult to Google this because men, right, in English. So like it just, it pulls up interesting things. And then at the World MEN meeting, I got invited to attend the Neuroendocrine Tumor Research Foundation's research meeting, and then really actually was able to start to get connections in the community to learn about research in neuroendocrine tumors, and really, that's been a big influence on my professional goals and career as well. So then for advocacy, I looked up the definition. That's supporting a cause. In 2020, I became president of Amend USA, and I'd already been involved for a couple of years, and so now I work with others to create programming and develop the community, and I hope have new advocates, and where that could be people advocating for themselves. Of course, people should be, and it might not always feel easy to do that. You might not feel like you have the language when you go into the doctor's office. You might not feel like you have the authority. And so, and then it can happen at the level of policy, it can happen at the level of grants, it can happen at, all these different levels. So, and I'm still learning, still dealing with disease. I had my third major surgery close to 9 months ago now. I had a liver resection. And of course, I'm still accessing those behavioral health services and support groups. I guess as I was thinking about this, COVID has not been good. And at the same time, it's opened up a lot of connections for me, for example, to attend a support group, to attend, say, things like Net Chatter. So that is a good thing. So the support group that I see is that I attend is in Indianapolis, which is about an hour drive. But with a kid on Saturday morning, I was finding that I just wasn't going. There was always something going on. So it's been really invaluable that I was able to attend remotely. So I hope that stuff stays and other stuff leaves. But now looking back, I see connections between it all, right? So I started out with this little map of maybe how things progressed up from a smaller size and in the initial diagnosis and a smaller size of a family and community to really empowerment with advocacy. But I could think about all the connections between them and then reorganize this. And it really, they're all influencing each other. My advocacy, the advocacy around me is part of the community. The advocacy influences my family and my family's health. And it's all embedded together. And it's not just MEN1. I think that this might reflect, it's not my patient experience. I mean, I hope that this reflects the patient experience, that we all get the chance to be part of this, circle of reinforcing where we have strength in numbers for our life. And I can't help but say that the Net Cancer Foundation is, of course, doing all this and bringing it all together. And it's been invaluable over the past, I was trying to remember, I was looking at notes, I've attended, I try to attend every time. I really appreciate what you all are doing and how you really are bringing everybody together and cutting across the lines and institutions that sometimes seem to hold us apart, but aren't real, but are, are problems for progress. And you can see the power of the community, the power of outreach, and the power of advocacy for its better outcomes and higher quality of life for us all. So if I was going to, I think I've talked rather quickly, but if I was going to do one appeal to the group and to the audience and to those who may see it, and that I hope that you see through this story of my family, the power of community, the power of outreach, and the power of advocacy, and that we can all do these. Maybe not all at once, maybe not all right now, things change, but by staying together, we have that strength and can make more and grow. So I'd like to thank you and thank all the volunteers and colleagues at Amend USA and Amend and all the other patient advocates that are just fantastic. And it wasn't just me, but my family and mentors and colleagues that got us all to where we are. And thanks for attending today's Net Chatter and generally attending and being the change that you want to see in the world. So yeah, I think I have resources in case someone were to want the slide or have questions about, I'm highlighting MEN here. So this is a link to our website, the colleagues in the UK, and Joe covers a lot of other conditions. And then if there are any clinicians that are looking to integrate behavioral health into their practice, I think this is a great start. And it's very powerful. It's clinically demonstrated along with MSBR to be impactful for those who have chronic diseases or have a cancer diagnosis. And I'm happy to talk about that as well. And then there's many other resources that I didn't mention. Just let me know if you want something specific. Okay, there. Stopping my share. Okay.
That was wonderful. Thank you, John, for taking your time out of your schedule to come and talk to us and share your story as well. I think both you and Jane have such unique perspectives that, someone like myself who sits in the lab all day, I don't get to see that side of the battle. I read the papers and the big words and try and make sense of it all, but you guys really bring the human back to what we do. So thank you, John, and thank you, Jane. We do have about a minute or so in case anyone had any questions or comments or something like that before we depart for the day.
Thanks, John, and thanks, Jane, for these insights. So since I'm not a native speaker, it's very difficult to express this in words, but yeah, it was very insightful. Thanks a lot for sharing that. So from both of your talks, I saw there were like few points about awareness, communication, maybe miscommunication, and a lot of information. And I was wondering, for your journey, what do you think was for you most important, or what helped you most to figure out kind of a way how you deal with it? Because I think that's very difficult also for a GP or for a physician to balance the information and the compassion, and maybe you can have a few words on that, on these points. What
my advice would be to become an expert in your condition. Become the person that asks questions, and if something doesn't feel right or sound right with you, question it until you get full understanding. Because I was I was the one person who respects doctors and what they say and what they do, and yet when I came out of Stoke, I went, I need a second opinion, and I will get a second opinion. And my personality changed in that these were just people going to work. They're going to do a job.
Yep.
And if they're having a bad day, that can impact on your day. And my life changed from working, living at 200 miles an hour to suddenly, from somebody who's never been in hospital to suddenly, I'm in hospital all the time. I'm at the doctor's all the time. I'm getting prescriptions. My life changed overnight to become this life I didn't know, and to write things down. And one thing I do that everybody laughs about is I keep an actual paper diary. Why do I do that? Because when they ask you, when did you last have a urine or blood take? When did you last give bloods? When was your last scan? Was it a DOTA PET scan? When did you have your last MRI? Because the GP doesn't know what's going on at Stafford Hospital. It doesn't know what's going on in London, and certainly doesn't know. They have you are the one that has to keep them all informed. So write everything down and keep a diary of everything that's happened, and become an expert saying, I haven't had a scan for this long, I haven't done this, and plan the dates ahead as well. So you look after yourself rather than wait for them to tell you. That would be my advice.
John, did you have a response?
Sure. Yeah, I think that's really good advice. I found the same to be true. And maybe I found that the hard way. I'm not gonna second guess all that's happened, but getting a second opinion is really important. And it's exactly like you said, Jane. This is their job, their people, not anything other than that. And so they're fallible to all the same things that people are. And so I approach it as a partnership now, not as if I'm going to be told what to do, but we're going to come to make a decision together. And it includes many stakeholders, my family, the team, myself, other experts. And so, yeah, I got a second opinion. I didn't, and that's one of I didn't talk about that, but I actually ended up seeing like 4 reviews before my liver surgery, because there's actually a lot of controversy on what to do in the context of metastatic neuroendocrine tumors and surgery. So, I took the time, and I will add that for those, it's not always easy to do that. And you're coming from a privileged, you're coming from a privileged position if you can do that. And I'm very lucky. And I think that that's where working in teams as patients also is really valuable. And because that first appointment, you know you're not going to be an expert, and it takes time to ramp up. And then some folks may or may not be able to do that. So having that patient level information available is really important.
John, I just have one
So I
question.
think that's where patient orgs come in.
I just have a question, John.
Yeah.
So did you have a physics background before? So have you found that being like a physics background, that kind of thing, has helped you understand your neuroendocrine tumors and just understanding the treatments and things better than, say, me, for example, with no scientific background?
Well, so when I started, I was a winemaker actually, and I had a background in chemical engineering. So in 2010, I was an assistant winemaker at a relatively large winery. So I think that the education that I've received since then, in my programs has been really helpful. But I don't think that it's required. I don't know. I think I'm stumbling on my own words because I'm thinking about them too much.
No, I think it should
never
not
overthink. That's impossible.
exactly.
But
it should not be required, right? So I think the job of the clinician or of the is to explain it to the patients, and I think it's the job to also translate it if this is necessary. You cannot expect that that the patient has a background that makes it easy to understand the disease or the condition. So I think that's a very important thing, that the practitioner also know that they have to translate, and it's not just throwing words at them. You have to explain it.
Simon, I mean, I agree with you, and I don't think it is apparently not that simple in practice, because of a whole host of factors, like how that physician might be feeling, what pressures that physician might have to turn over the room, the rapport with the patient, the patient's education, like the patient's background. So I think that we need more than one system. Relying on only the physician is not robust enough, I think. So it doesn't take anything away from what you said. I'm trying to add to it and say that it's also important to have other things too, like learning about Creon, for example. How important is that if you've had, if you have decreased pancreatic function? And so knowing that's something that might only come through in a patient support group. And that's just one way that it works. And also, I wanted to say that, I don't even remember if I'm gonna. So Selena, to your point, I don't think you need that kind of background. I think that it's been helpful, and maybe it was needed for me. I don't know that it was needed for Jane. I mean, Jane, you can speak to that, but I mean, you seem like a badass. And I think that, I came into this with my own background and my own set of things. And for me, it's, I think I've wanted to earn that authority. Other people, I think the founder of this group is a great example of that. Just, you do it by what you have, and you pull yourself up a bit by your bootstraps, right? And you just get out there and make it happen. And so everybody's different, and will need different things, need different resources. So Selena, again, to just hone in on that and clarify, I don't think that people need that. And it sure was helpful for me, maybe I needed it. My sister sure as hell didn't, you know? So, sorry, I got a little fiery.
No, I love the discussion. Like, these are the important conversations, you know, when we all come together from our different perspectives. You know, these are the important conversations that we're having. And unfortunately, we're about 9 minutes past the hour, and I could guys for, you know, hours on end, but I will go ahead and bring the meeting to a close. But I just want to thank you all again for being here. Selena, would you like to say a couple words?
Yes, can I just say that this is our last Net Chatter for 2022, only because we then get involved with you lot, where you have Thanksgiving and Christmas, and you're partying now from now until the new year. So I just can't get you on the meetings. So our next Net Chatter will be on Thursday, 26th of January, 2023. God, it seems a long time away, but so happy Thanksgiving, everyone. Have a lovely Christmas. Have a wonderful new year. Keep healthy. And I would really love to do this patient story again, we're a bit sooner than next November. So I think this has been really helpful, and it's been really interesting hearing people's experiences and their journeys through their diagnosis and the journeys they're on at the moment. So thank you very much, everyone, for coming. And thank you.
Thank you.
Thank you all.
Thank you very much.
Thanks.
Thank
Bye-bye.
you. Thanks.
you.
Bye-bye.
You.
Bye.
Bye.